Work Wellness Institute is transforming research into workplace performance and health. As an organization, we function throughout the complete cycle of turning research into practice, mobilizing knowledge as a research institute, community partner, funder, and educational provider. Our mission of creating safe, healthy, and inclusive workplaces for all is our driving motivation. Learning is a lifelong journey to adapt to the forever-changing needs of the workplace. Whether you are a leader, a professional, an academic, or a student, we provide high-quality resources that are evidence-based, topical, and relevant to all industries. Choose the Work Wellness Institute as your learning journey partner and become a member to gain full access to our diverse knowledge mobilization programming, including lectures on demand, e-curriculum, 3 distinct certification opportunities, and more. Continue to learn and connect with the Work Wellness Institute and see how we can support transforming research into performance and health for your workplace.
Would like to officially welcome everyone. Thank you so much for joining us today, whether it may be the morning, afternoon, maybe even the evening for you. So again, welcome to the session and thank you so much for joining us on our topic today of cancer and work, update on research, education, and practice. My name is Elizabeth White and I am the manager of programs here at the Work Wellness Institute, and I'll be here to support in hosting and moderating today's webinar session. I would like to start by acknowledging that I have the privilege to live and work on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Squamish, Tsleil-Waututh, and Musqueam nations. This webinar is made possible through the support of our funders, partners, as well as memberships to the Work Wellness Institute. And of course, we would also like to extend our thanks and gratitude to our advisory committees, as well as the speakers who contribute to this webinar series. And we're so excited to welcome back both Dr. Christine Maheu and Maureen Parkinson. We're very excited to have you here today. Dr. Christine Maheu is an associate professor at McGill University's Ingram School of Nursing, is a leading researcher in cancer survivorship, focusing on return to work challenges and fear of cancer recurrence. She co-directs Cancer and Work, Canada's premier bilingual resource website, and has co-developed FORT, an evidence-based intervention to manage fear of cancer recurrence, which she is working to integrate into routine care worldwide. Dr. Maheu also leads a pilot project to support cancer patients returning to work and collaborates with international partners to adapt her interventions for diverse populations. Maureen Parkinson, who holds her MEd and CCRC, a vocational and rehabilitation counselor at BC Cancer, has been a trailblazer in addressing employment challenges faced by cancer patients since 1994. She also co-founded the Pan-Canadian Cancer and Work website and developed resources like the Supporting Cancer Survivors Return to Work for Primary Care Providers course, reflecting her dedication to improving survivorship care. Through workshops, publication, and events like the upcoming Cancer and Work and Employment Symposium, she continues to empower stakeholders and shape policies that support cancer survivors' return to work. Again, we're so grateful for both of you to be here today, and I'm more than happy to pass things over to you to lead today's session.
Thank you, Elizabeth. Thank you for that nice introduction as well. We're happy to be here, as you said, like again, and to give you actually an update. So on Cancer and Work, some update on the research and on the education and on the practice side. So next, just to get us started in the area to discuss cancer. Goulash, yeah, thank you. Just to get us in the context of cancer, I'll just briefly discuss some Canadian cancer statistics. And so here what you're seeing is that in Canada, there's an estimated 247,100 Canadians who receive a cancer diagnosis in 2024. And this represents a ratio of 2 in 5 Canadians who will be receiving a cancer diagnosis in their lifetime. But fortunately, cancer survival rate, as you see, are improving due to better detection and treatment, where we have 64% of the adult diagnosed with cancer that can be expected to survive 5 years post their diagnosis. But what we see in terms of when in their lifetime people are diagnosed is that we see that more than a third of the cancer individuals are being diagnosed under the age of 65, or what we say within the working age of between 18 to even up to 67. And that's if we look back at our statistics of 100,000 diagnosed in 2024, this would translate to over a bit more than 91,000 working age individuals that are living with and are in the workforce. And so with our current individuals diagnosed with cancer in 2024, with that survival rate of 64%, we also see now that there's a projected 1.5 million Canadians that are living with and beyond cancer. And further translating this with our 37% of being in the working age people, so that would be about 555,000 projected Canadians that are living with and beyond cancer. But here we must recognize as well that within the significant pool of working age individuals who, for whom returning to work is crucial for themselves and for society as a whole, we also know that working will enhance quality of life, will enhance the self-esteem, and we also know that good employment is linked to better health outcomes, while being unemployed will negatively affect their health. So, however, while the evidence indicates that individuals with cancer have a higher probability of being unemployed, to about 40%, this would translate to these 555 working individuals with and beyond cancer, with 222 that could be at risk of quitting or losing their job. So here, it doesn't mean that cancer directly will cause unemployment, but rather it's a statistics that reflects the association that could result from having cancer and the work outcomes. And this comes from, there's many factors that are associated with that, such as lingering health challenges following their cancer treatment, workplace discrimination, lack of support, or reduced work capacity following the treatment. So while the workability does improve over time with post-cancer diagnosis, it does necessitate support program for return to work. And later we will discuss some of these programs that are being seen as effective. Next. So here is to talk about the percentage of working individuals that are returning to work within the first year post-diagnosis. And so we see that the average rate of return to work within 1 year is 63%. And there's a range that it plays out for other countries. This was from a study in Germany, but there's other areas that we see that the average could be from 52 to 42% returning to work within that first year, but they are returning as well with some challenges that will impact their work productivity. We also see that as a significant proportion of individuals that will experience those work limitations, with 39% needing to alter their work schedules because of their treatment or being affected by their cancer. And there's also 57% that have been having to reduce their work hours, but at least 4 hours per week that we have here on the slide by a study by Steiner. So again, both scenarios being indicative of having returned to work, but with some great difficulty. So as such, we will see a higher relative risk of being unemployed, where cancer survivors are seen 1.4 times more likely to be unemployed compared to individuals with no cancer, with a 26 to 53% of losing their job or quitting during or after treatment. And again, these changes in employment status lead to, as you would guess, or as you would know, some financial difficulties. And so the evidence does show that poor physical functioning and unmanaged symptoms and distress will delay the return to work and will hinder their work productivity. And that psychological distress and limitation will also noted as barriers to returning to work. And on average, what we see is that 49% of individuals will experience what we call these cancer-related fatigue. You have others as well who will experience cognitive challenges, which sometimes referred as chemo brain fog. Individuals, 49% about will experience anxiety and depression following their cancer experience, fear of recurrence as well as a common one, and 67% will have functional problems. And so for these, they would require targeted intervention to help these individuals to also want to prevent the work disability, but to ensure successful return to work rate, which is achievable with proper support. Next. So as I said, with having these challenges and reduced work hours and risk of unemployment, it does impact the health and economic burdens in Canada, where we see that the financial burden experienced by cancer survivors can become significant, where 1 in 3 will experience financial burden. And we also see a greater loss of earning for the self-employed and the female. So self-employed, we see that they report an extra 37 to 48% loss of income, again, exacerbating this financial strain following cancer. And individuals diagnosed with cancer are reporting spending 34% of their monthly income on cancer-related costs, so medical equipment, childcare, home care, transportation, and other. And these friction costs will incurred by Canadian employers. There's also friction costs incurred by Canadian employers to replace the absent workers due to cancer, and it's estimated at about $6,000 to $24,000 per employee with cancer, depending on the time of delay to return to work and the role that they have. We see as well that the average duration of sick leave for a cancer patient can reach up to 168 days, that again leading to substantial indirect loss. And there's also the productivity loss that's estimated at 75 million to 317 million annually. And this productivity loss will include loss to leisure time, unpaid work, premature death, disability costs, and the chain of events for absenteeism. And then there was, I'll try to pronounce it, Garescu, who did a study that published in 2022 that he estimated that the projected economic burden of cancer in Canada was estimated at 26 billion, with a third being endured by patients and their families, so translating to about 7.8 billion for them. So you can see that there are a lot, there are a lot of psychological responses to these financial hardship that would affect the individual's well-being. So with reduced income comes with reduced financial resource to invest on their own cancer rehab. So that will have an insignificant impact on their return to work. So in conclusion, the economic burden of the cancer is significant. So it's essential to consider the potential to improve productivity through early detection, effective treatment strategies, and of course also better policies and benefits that would provide for more efficient support to enhance the return to work outcome and success of individuals that are touched by cancer, and also to mitigate these long-term losses and financial burden. Next.
So I'd like to remind people or introduce for some the Cancer and Work website that's been in existence since 2016. It exists of 500 pages of content, 8 interactive tools. It's has an advisory group and specialist writers from various disciplines, 9 videos in 2 languages, French and English, and 1 online course. It's designed for survivors, healthcare, and employers. In a systematic review, it was considered one of the top sort of survivorship websites for cancer survivors. And in 2018, it was given a best practice healthcare standard award from the Healthcare Standards Organization. It's essentially the first website in Canada that links resources around the world, but also in developing this, we also wanted to pull in information that we sort of felt was lacking. Next slide. As mentioned, our goal is to support stakeholders all involved in return to work for cancer survivors. So our information is catered towards cancer survivors, healthcare providers, and employers. Next slide. So this is just a review of the topics, and you can see, you know, that the topics sort of range, but there's also a lot of parallel topics, and we did that on purpose. So essentially, especially the return to work, stay at work section is designed to sort of mirror each other and tell each sort of stakeholder their role and their task within the various sort of strategies in order to sort of basically foster sort of good communication and alignment in terms of action, in terms of supporting return to work. Next slide. So we also have various tools that are available. One was a job analysis to help survivors or employers that may not have job analysis, just to inform healthcare providers, job expectations, a task analysis, an Energizer drainer tool, fatigue tracking tool, and a cognitive symptoms checklist at work that was developed by the editor of the Journal of Cancer Survivorship, and was formerly editor of the Journal of Occupational Rehab, and it's a validated tool for those who are back to work, and the Return to Work Planner. And Christy's going to tell you about the cause. Next slide.
Just quickly to tell you, this is a new tool that we just validated, that we've been working on it for the last 6 years, I would think, but it's finalized now. We're working on publishing the paper, but all to say it's a valuable tool to assess the likelihood of the individuals to be able to return to work, to sustain work, and also to be able to sustain those working hours in the context when they had to reduce their work hours, but they have returned. And so we have this tool that has it's a 7-factor tool, 31 items, and it has a cutoff to indicate if beyond this cutoff that this individual should be flagged for being at risk for being able to either return to work or sustain work. And depending on where they score on these 7 subscales, there's a likelihood scales for each of the items. It gives also the individuals direction for strategies on where to act upon and to provide support and intervention. Just to give you a bit more information, like I said, so we tested it was 2 studies. In the second study, looking at people that had returned to work and not returned to work, and we had 116 individuals with cancer who were 1 year post-diagnosis, and what we post-treatment, sorry, and what we found with these 7 factors, it explained up to 75, 65, almost 67% of the explanation of in the context of people who had returned to work or were not able to sustain work. And so that's why I do find that this tool is quite valuable for these aspects.
Great. So I'd like to go over the 4 factors vocational rehab model in terms of influencing return to work. So the first, and this is essentially a review and update of what we initially presented for work wellness back in, I think it was January 2023. So next slide. So the first is cancer and its impact on function. And so what we see in the return to work literature is that we know those are facing limited prognosis, recurrence, or another cancer, or have more severe forms of cancer, have a higher percentage of adverse work outcomes. That said, I'm seeing more patients just clinically with innovations to treatment. I'm seeing more and more patients that feel, even though they're indefinitely in treatments, they're feeling that they might want to work a bit. Those undergoing high toxicity treatments such as chemotherapy, multimodal therapies, mastectomy, it can negatively influence the likelihood of return to work and sustaining work. Those with pre-existing conditions or chronic illnesses have a tougher time to return to work. I'm thinking depression is a common one. Those with fatigue, depression, anxiety, cognitive challenges, pain such as neuropathy, lymphedema, and reduced range of motion significantly increase the impact on function and have increased likelihood of extended leave and decreased chances of returning to work. And according to the research, the general research, it varies from 30 to 60% of cancer survivors experience distress, which can be, and distress is considered a combination of anxiety and depression. I see clinically, certainly one of the most functional challenges, cognitive challenges, and certainly this can be chemo brain is commonly termed, but it also can come from anxiety and depression and fatigue. So a differential diagnosis is really important. The degree of cognitive challenges related to chemotherapy is more likely the more treatment that is offered, and there's no indication on who and how much and how long it's going to last for somebody. For some, it resolves and improves, and for some, it can linger. Common chemotherapy cognitive challenges are reduction in concentration, memory, working memory in particular, focus on speed of processing, and psychomotor function. So next slide. So the other impact of function is for some people see work as positively and they feel it a sense of normality, social interaction and control. It's seen as a healthy distraction from the illness. Work has meaning as well as a means to restore identity and improve finances. But others may see work as less meaningful or important or even detrimental to their health. Those who perceive work stress as a contributing factor to their cancer or a barrier to recovery may be more hesitant to return to work and may see work-life balance is more important. Additionally, cancer survivors who previously overcommitted to their jobs are less likely to return to the workforce, and those with higher levels of occupational stress have been associated with greater likelihood of early retirement. Those in terms of self-efficacy, those that anticipate poor workability are less likely to re-enter the workforce, and expectation of job success predict return to work and work functioning. So essentially, it's important to ask people if somebody is saying that they're concerned about the return to the work in the future, that is possibly a hint that they're going to have a challenge down the road. Survivors may also be reluctant to request accommodations that they may need for fear of being different, having negative perceptions of their workability and job loss, and being perceived as a burden, and wanting to feel normal and not wanting to ask too much. So demographic factors, research indicates among cancer survivors, those are older, women, non-white, lower income, low education, or more likely to experience difficulties with return to work. And increasingly, I'm seeing more people attempting to return because of financial hardship. I think Canada is, we're getting a little more expensive to live here. So a lot of people are coming back, wanting to come back to work before they're ready. Next slide. So will we see medical support such as timely access to work-focused medical rehab, discussing return to work plans over time, diagnosis, so from diagnosis to even post-treatment, helping define work goals and assessing work readiness and addressing symptom management can positively impact return to work. But we're also seeing at the same time, particularly in physician level, that they struggle, that they don't have the time, don't have the training, or don't see it as their role. Some research is suggesting that occupational therapy and voc rehab support would be helpful, but unfortunately, that's rarely offered within the healthcare system. We're also seeing, in this case, sometimes we're relying on in insurance organizations to provide such support. But and I think in particular chemotherapy, I am we're a cognitive problem, cognitive related chemotherapies related to chemotherapy. I'm finding that more it's the support like occupational support in order to assess this adequately, or neuropsych support is limited or rarely offered and not offered in a timely way. And I sort of see that as an opportunity there. Um, for those, and again, as I mentioned, we're seeing this whole group where those who are permanently disabled or and indefinitely in treatment would like to return to work potentially at some capacity, but the insurance systems aren't sort of necessarily designed to support that. We also see those with lack of financial support or low income jobs struggle with return to work compared to those who are not. Sometimes, as mentioned, sometimes cancer survivors are returning before they're ready for financial reasons. Also, family and cultural benefits can impact positively, negatively, return to work. And in terms of legislative support, can positively or negatively, or lack of it, can influence. Of note, there was a study in Canada, and they found that those in the union um, were less of them returned to work than those that weren't. Next slide. So in terms of work-related factors, high demand jobs, manual work, blue collar jobs, those are self-employed or working part-time had a harder time return to work. As mentioned, occupational stress and higher commitment to work had higher retirement rates. Employer support, both practical and emotional, is considered a facilitator to return to work. So practical support includes providing job accommodations such as time off for medical appointments, sharing workload, changing duties or reducing hours, financial for the duration of illness, and paying for a sick leave provision. Emotional support includes an open attitude, positive, respectful, being flexible, demonstrating a real interest, encouraging the cancer survivor, understanding the survivor's situation, treating the survivor normally, and maintaining the survivor's privacy, and showing commitment to the supervisor. And this includes ongoing communication, and that includes discussing ways to communicate and communicate in non-invasive ways, such as through text and emails, and including discussing return to work plan with the survivor. Negative environment also has a factor, and non-supportive, rigidly structured, competitive, and poor, ambiguous, and frightening, and patronizing, discouraging, and pressuring communication from employers, and overestimating work ability, such as invisible physical changes, fatigue, or cognition is a barrier. The lack of understanding of late effects by employers can overestimate the survivor's abilities, perceive barriers for work participation and discrimination, and stigmatization as perceived barriers for cancer survivors' work. This is made worse by previous strained relationships, and employers' willingness to support can be a consequence of the organization's cultural policy and conflicting goals and lack of external help. Sometimes knowledge of the return to work policies and obligations do not always make it down to the supervisor. And one study even showed that collegial support could even mitigate the lack of supervisorial support. So next slide. So I'd like to move on to a study that was done by Mary Keto a few years ago, who's a professor at University of Toronto, and it was with 40 cancer survivors, healthcare providers. So they found recommended accommodations included graduated return to work, included working from home, providing time to attend medical appointments and support programs, medical and rehab appointments and support programs, modifications of performance expectations, so not expecting you to be at full capacity right away, and elimination of non-essential jobs, retraining and supports, so time from reorientation and retraining, job shadowing, assistance from others to ensure essential tasks are completed, and modification of the work environment and provision of adaptive aids. So processes that were helpful were ensuring employees were the duty to accommodate, and survivors were aware of this and they had the right to request this. Um, Understanding how the employer is providing the accommodations. So having a sense, I think, for both the survivor and the healthcare provider to understand so the limits of that the employer can provide for accommodations, and having the survivor and employer work together to establish each other's needs and negotiate a reasonable approach, customizing employments that are task specific, and monitoring the plan to ensure accommodations are being implemented, and ongoing communications and addressing challenges when they arise. And I think related to that is the encouragement that monitoring should go well beyond the return to work plan, and should be, well, given that many people have medium and late effects, and continue on. So next slide. So just off cutting edge research here is there's an update on the Cochrane review in terms of intervention plans. What we see is for the ones that had no or uncertain evidence of help, in terms of return to work or no change in return to work. The psychoeducational groups, which included lectures on side effects and coping, follow-up phone calls where patients were encouraged to do health promoting behavior, such as goal setting and problem solving, and informative services, fatigue or education after radiation, or distress, pain, and financial need or severe distress. And discussing supports with their doctor had made little difference. And there was also a study done with employers where and it's by Grinius and Tedke, and where they sort of feel that employer education would be helpful. And this is an online resource full of videos and information and things like that. And they didn't seem to support, but they sort of felt there were flaws in the study because they had to sort of do the recruiting through their patients, and sort of felt, and they're sort of jigging that. What has made a difference is exercise. And just to note, I didn't mention it, these are only, of all the studies that are out there, there's only 15 in part of this review. So an exercise, a combined resistance and aerobic exercise, supervised by a physio, a 12-week yoga course before chemo, biofeedback, and even floor exercises for those with prostate, and a high intensity with resistance and endurance training was found helpful. In terms of a multidisciplinary intervention, essentially it involves sort of a vocational sort of focus, and include a nurse advice to breast cancer patients to exercise, guiding arm movements, encouraging return to work and being socially active, and combining social skills training regarding return to work and exercise. A case manager working in a multidisciplinary team, which refers to physical and occupational therapy and resources as needed, and psychological supports as needed, and a nurse social worker working as part of a multidisciplinary team, providing vocational support, counseling, education, and return to work advice, and a 4-week guided workbook, which asks survivors to incorporate their learning into return to work plan, and tailored support depending on the severity of the work problems, which include disease-related problems, the importance of work, and contacting the work environment. Next slide. So I'd like to introduce remind everybody the ICANN work that we've developed. And essentially it falls into sort of three categories. The assessment, which is looking at assessment of, again, the first part, which is reviewed the four factors that influence return to work. Can we look at next slide again?
Yeah, just need to click 3 times.
Yeah, click that, Christine. Thanks. I wondered where it went. Okay, so understand the factors that impact work, assessing function in relation to understanding this in relation to the job. The next stage is basically assessing stage. The next stage is addressing, which is encouraging the cancer survivor or asking the medical health professional to identify and treat the functional challenges or refer to support that can make a difference, and also, or in fact, making recommendations to insurance providers to provide these services, again, such as cognitive, neuro, and work-focused occupational therapy, and encouraging survivors to take control. There's many resources, and I think this speaks to the Canadian system, that there's resources that exist within the healthcare, but there are online services and resources in community organizations that they could access. Like there are many exercise programs out there. And then the last stage is identifying and is to look at transitioning back to the workplace. So again, given the research is talking about the importance of a supportive workplace, we talk about encouraging that, contributing to the return to work plan, asking about symptom management as somebody, one biggie being sleep disturbances before return to work, managing expectation, which includes getting clear guidelines, restriction limitations for the medical team, and recommendations for accommodations. And as mentioned, continue to monitor the work situation well after the return to work, the graduated return to work plan has completed. So next slide. So just wanted to remind you of this course. It's only available for 2 more months because we like funding to continue on, but it was essentially an e-course and it's freely available. It's supporting a course. It was there to initially guide primary providers, family doctors, and nurse practitioners, and it was developed by what I think is a great team, book rehab, occupational therapy, pain and symptom management, a number of family doctors, 2 psychiatrists, and a cancer survivor in terms of developing this. And it's currently available on the UBC website. Next slide. So we've done an evaluation of it and what we found is so far 260 people have taken the course, 30% being physicians, 21% nurses, and 20% allied health. And next slide. So overall, the feedback has been fairly good, essentially in the 90 stage for agree or strongly agree. I'm able to identify factors that impact work. I'd recommend this education to a colleague. I recognize timely ways to address barriers to return to work and improve workability, and the education met my learning needs. So next slide. So just in terms of comments, skills and confidence, the participants felt it helped facilitate return to work, helped them feel more confident about doing this, felt better equipped, gave them a better understanding of many of the components that influence return to work, and provided more holistic care, and even helped sort of identify potential barriers and better skills. Next slide. So what we found are the barriers, again, is back to what the research sort of echoes, is the lack of time to do this, and also lacks the resources, that exist, and to find, and lack of a bit time to access and determine these resources that might exist, lack of OT, which I certainly agree with. And then the others is someone talked about resistance to permanent accommodation. Somebody had sort of said that, realizing that return to work is not a binary option. Anyway, so next slide.
Okay, so this is my part. Just to talk about more of what Maureen presented on the I Can Work 10-step approach that we have on our website, but we also did a pilot study that I'll show you some of the results after. But just to give you some of our rationale of how it came together. So it's based on the vocational rehabilitation model, the 4-factor that Maureen presented, but it's also based on her practice of 30 years in being a vocational rehab counselor at BC Cancer and providing return to work support, and also on an initial booklet, practical guide for returning to work for cancer survivors that was published, I think it was back in 2011. And then further on, how we continue to build the I Can Work and what's behind it. We also looked at the what was in the literature of what best approaches for vocational rehab intervention. At the time we developed it, we didn't have the one that Maureen presented of the DeBowers. This was the Cochrane Review published in 2024, but we had the 2009 and 15 that really put forward to have a multidisciplinary approach to have with vocational lead and work focus in order to have a meaningful impact on supporting individuals with cancer to return to work and sustain work, and also having screening and assessment in place within that intervention to be able to identify different impairments following their cancer needs treatment. Also having their strategies and ways to improve on the healthcare professional, HCP, employer communication, bringing as well more awareness and access for resources for the individual with cancer and the healthcare providers. Having it, like I said, a workplace focus, really stressing that importance of that vocational rehab being integrated as a workplace perspective, a comprehensive step that also would incorporate some guidelines. And we used some that were proposed by Ziegler that has published on a return to work intervention as well. And when we did the website, we also had created our first initial version. So we did get positive reviews and we did get some feedback at that point, and also those from the course. So the course, the module that Maureen presented is also, its foundation is behind the course is the I Can Work 10 steps. So we got, as she just presented, some feedback in what works and what could be improved. And so we also had identified that there was this huge niche, and especially in Canada, we didn't have a test and intervention. There's been others in other countries for returning to work interventions. But like I said, it's modeled after the BC Cancer approach from Maureen. We've incorporated into this pilot intervention using expertise from vocational rehab counselors and occupational therapists as well, which are really two key experts in return to work. But also with experience in oncology, just not just general expert or generals, but a very specialized individuals of VR and OT in oncology. We had an approach using occupational therapies in intervention is still untested, but it's suggested, but it hasn't been yet validated. So what I'll present was the pilot RCT that we did, and then having an employee engagement. And we had identified there was limitation, even on our web resource, the Cancer Work, it's been well received. And we, on average per week, we have over 1,000 individuals that come and use the website, different pages and resources. But it's still some of the feedback we're getting is that they would like to have something that would provide for direct services and provision and more direct support. So that's why we went ahead and said, well, let's test it out into a pilot version of the I Can Work. So next slide. So what
also, 10 minutes, just the 10 minutes.
Okay, so let me go quickly because Maureen has a few other important slides to present. So in terms of the patient feedback, we had 12 individuals who received the intervention, 11 who were in the control group, meaning just referred to what we said, go look up the website by yourself. But those who received the intervention had 2 to 3 vocational rehab counseling online support by a VR person, and 1 to 2 from an occupational therapist, guiding them through for preparing for their return to work, and also sustaining work for those who, when we took them on into the study, were close to returning, had returned, and we did the follow-up with them. What they found, they were highly satisfied. They really felt they were highly supported by professionals as well. They were provided with useful information. They really felt that the recommendation they received was something they could easily apply to their context. And they felt that it was credible support that they received, and also the information from their website. But the support itself, they felt it was easy to understand, good advice, and easy to be the direction they were given. So next slide. And more, these were like qualitative kind of outcomes. For the quantitative, we assess the rate of return to work, workability index. So if their score for workability improve, and so we saw improvement in the experimental group for higher return to work status rate, workability index, quality of life score, and of course satisfaction. And so we do find that this pilot study at least contributes some valuable information moving forward to then we're working on to producing the randomized control trial of this intervention, and to further contribute to see what would be a valuable intervention to provide better support. But now with the latest DeBauer's Cochrane review for effective return to work, we'll also add in a component of exercise and guided movement. So next slide. And so just to say that we recognize we need a deeper understanding as well as the other side of the coin from the employers in terms of what are their barriers, and what's in place that works, what are the barriers, what else do they need in terms of information. And so to do this, to have that Canadian landscape of what's happening in Canada from the employer's perspective, from the union perspective, supervisors, HR, we're please inviting you to complete the survey that we have currently going, which really aims at gathering all this data to put it together, analyze it to see so that we can then provide recommendation for change, but also to provide some research priorities and what should be geared to for supporting the employer's perspective, for supporting individuals or employees with cancer to return back to work and sustain work. So please consider completing this survey, and we will also be using the information, I think it's in the next, in some of the slides, but for a symposium that's coming up. Next slide. So really quickly, some takeaways that, to take from this today's webinar is that really what we're also seeing is that cancer is not just a diagnosis, that's something that happens in the older population, but it's being more found and diagnosed in younger population. And as I quickly presented, it does come with a personal cost, and we're seeing even a higher cost for people that are diagnosed at a younger age. And there are things that can be done as well from risk reducing behaviors that can be done, and education to improve on those statistics. We also know from point number 2 that survivor-focused return to work programs for those that have been assessed, but we do need more rigorous program to be tested, do have a better impact for producing reduced turnover and also cost for retraining costs. And those programs, one of the main key strong predictors, having those work accommodation or having it in place flexible work accommodation. And then the third point, again, speaking to the second, is having these structured work-focused cancer rehab support that will improve what we're seeing is that improve the individual's self-efficacy, so confidence in themselves and their ability to prepare and return to work and to be able to sustain those work and to sustain employment. So it's not just about providing general even exercise program, but it's really one that's multidimensional, multidisciplinary, and having a component of cancer rehab, but specifically work focused. And then looking at point number 4, do opportunities to enhance the long-term disability to promote return to work. Maureen slightly made that point in terms of, can we provide additional form of options of, let's say, partial disability, so that individuals can come back to work, do a portion of their work, but still have that replacement of income for what's missing from not doing the full-time work. And then lastly, in terms of resources, being aware of the resources that are out there, either to so that the individuals feel that they have they're more equipped, they're more resourced in terms of what can they do for themselves. So self-management is a strong point in terms of improving their not just their ability, but their self-efficacy of being confident of returning to work. So we have practical tools on the website they can access, and also valuable resources for the employers. Although we still have to expand on that section, but we also have some that employers can go through to see what can they do to also support their employees with return to work and sustain work after cancer. And next slide. So here, Maureen, did you want to speak to this one, or is it me?
Well, yeah. So yeah, we're continuing to look after sponsorship, not only to sort of continue Christine's education, but to maintain, develop, and expand resources. And we're also sort of wanting, again, as Christy mentioned, really want to focus on the employer section. So we're inviting members to join the advisory group in order to sort of learn the needs and also address with information the needs we can for employers. We also, as Christine mentioned, we have the survivors, the survey. I encourage you to participate in the survey, and also, and that also is going to feed into an advocacy meeting for that is going to be the at in Quebec in April, where we're going to put together the stakeholders and sort of hash out sort of opportunities and best practices, and that's jointly hosted by the Coalition of Quebec, Cancer in Quebec in 2018. 225. Okay, next slide then, I think we're done.
Yeah,
So
no, just
thank
one
you.
slide.
So
But
there's, yeah.
this is just again our QR code for the survey, but it's just to say some of the survey, not all, but all of the survey data that we'll compile will be analyzed, but also to feed into a think tank where for the symposium on May 29th and 30th in the province of Quebec in Montreal, that's going to happen to come together to see where can we provide recommendation and policy changes so that we can better support also the individual with cancer and our employees, you know, to so that everybody can come together as a society to be able to help the individuals to remain employed and enjoy work as well. And so that's the symposium that's going to happen. If you have an update, we'll keep you posted on our website in terms of the hotel that's going to take place and the specific agenda to come. Next slide. I think, yeah, we're at the end. So we'll be delighted now to take on your question.
Thank you so much. I know that was a blitz to the end. It always feels like never enough time. So we so appreciate you taking this time and providing all of this wonderful information to our audience. I will remind everyone we have both the chat and Q&A function. So please feel free to type in your questions at any time throughout our last 10 minutes together as we go through the Q&A today. So I'll just get us started with our first question. So when you're thinking about someone who is looking at supporting someone throughout their return to work journey, how can you, as the person on the human resources side, maybe the direct manager side, open that dialogue? As you mentioned, there are sometimes hesitancies for someone to advocate for themselves, or maybe as the cancer survivor bring up the conversation. So how can you be that support in opening that dialogue and leaving that room for them to advocate for their own needs?
Well, I would, a lot of the best practice HR is you want to stay in contact with somebody so they have connections and things like that. But I think Renius's comment about like talking about how you're going to connect with each other is really helpful. And also, I think, the issue disclosure is interesting. I know it's hard for HR. It's so much easier if somebody's willing to disclose and things like that, but for many reasons. And I think of the UT study by Stewart that talked about 11% regretted disclosure. So that, respecting disclosure and talking about, what they want communicated and how it's communicated and things like that. But I think ultimately sort of going through and saying I want to check on you and all the things that the supportive workplace, like it's intent, it's not procedural. So I've certainly had patients where they've had disability management show up their door saying you didn't answer me, well, and it felt like it was intrusive. So it really is about the relationship and talking, and again sort of discussing how would you like to be connected. We want to be connected, we want to show support. So it's the front up, sort of the laying the foundation of a supportive workplace, I think is really important.
And if I can add, it's also
Yes,
about
please.
having having that positive organization culture where you open up this communication door that talking about cancer and its impact on work that it can be done in a safe environment, and that can start by providing some workshop education for the supervisors and the employees to better understand, what is it like for an individual who's had cancer and dealing with all these late effects and long-term effects of cancer and wanting to return to work and wanting to be productive, but there are some challenges if they're experiencing still fatigue or difficulty with their thinking process and all. And these aspects are invisible. So for some individuals, when they see the employers return, they look good, they feel good, their hair is back, get the makeup on, but it doesn't mean that all is fine. So returning to work is not the end point. The struggle continues, but if there's a better understanding from the colleagues as well, then they'll be more supportive when the individual has to put in place some accommodation in order for them to be able to be back at work and sustain their work. In terms of timeline, again, that can be discussed and explained, and yeah.
And so related to Christine saying is ongoing sensitivity training of coworkers. So we know coworker support can make a difference. It can also, and lack of it can make a difference. So again, I think it is sensitivity training around people who have disabilities, whether it's invisible. Not only cancer, it can be helpful in terms of, again, you might be doing a little more now, but it could be you tomorrow, that type of thing. I think is helpful to setting the foundation, setting the culture and the work environment so they can accept illnesses and disability.
Absolutely. So much to kind of chew on and take on, and always looking at that individualistic approach. We have another question around being an EDI member in my organization. Assumedly, that would be equity, diversity, and inclusion. So, as a member of that kind of committee in a workplace, I would like to know what would be an initiative that can fall in line with the work you've discussed today in supporting survivors returning to work or alleviating their anxiety related to receiving a diagnosis.
Well, I think it's like anything. I think with the equity and diversity, I think the secret is that we need to be responsive to people's individual needs. And I think that's the biggest, the thing with cancer. The cancer varies, but also the person varies in terms of their needs. It's not cookie cutter. And we always have to be open to that. And that's part of good practice vocational rehab is to be responsive to that individuality.
One thing I'll add is to remember that cancer, in terms of supporting individuals who've been touched by cancer, there's no cookie cutter approach. So it's also to recognize that it's also is different from other chronic diseases, but also each cancer cases are also to be seen as individualized. And so it does require that each intervention be revised to be individualized to this person for the challenges that they are experiencing, which will be different from one person to another.
Absolutely. So if I may be so bold too, and even just to direct to, again, the Cancer and Work website, particularly if you're a member of an EDI committee at your workplace, I imagine that would be a great place to start in doing some research on resources that maybe they can bring forward to the organization, and even sometimes a review of policies and processes, because I think that's something that you've discussed as well, that sometimes, in your onboarding, you may have been pointed to a return or accommodation process, but you've been there 7 years. So it can even be helpful to have lunch and learns around strictly just policy reviews and getting everyone on the same page there. Wonderful. So moving into our next question is around just that balance of needs, and perhaps in the situation where something isn't going well, and accounting for that. Things, maybe there was a perception of, oh, I can do this, now I can't, those kinds of things, and how to support someone through when, a plan's maybe been put in place and now it's not working, and how to have that conversation and maintain that flexibility with still feeling that support.
So I think that's one of the punchlines we have with the return to work planner is you need ongoing assessments. Like, and again, that monitoring shouldn't stop just at the end of a return to work plan so that you can be tweaking the accommodations. And even to the patient, we even say, like again, I do have a lot of patients that are racing back for various reasons, and they may need to step back and evaluate. And I typically encourage my patients to make a doctor's appointment halfway through the return to work class to assess and address again to see, does more services need to be provided? Does it need to be slowed down? Are there other restrictions and limitations? So I think it's if there's ongoing communication, hopefully what we can do is we address it as it comes. And again, it's not a standard. There are things that we can't possibly predict in a return to work that may bubble up that people haven't considered.
Mhm. Because sometimes it's just only when they're back at work and attempting to do all these different tasks that will create a trigger to even some of the late effects with, let's say, cancer distress, anxiety, and depression that may not have been so much at the forefront before they were not at their work site, but once on the work site with the added psychosocial risk factors that came as a trigger, and then now they're having more difficulty with the cancer-related distress and how to manage that at the workplace. So that's why it needs revision, and it needs also a different approach on how it can be best supported so that the person doesn't end up having to leave work again.
And
Yeah.
I relate to that. I think, the challenge within the healthcare system is the lack of ability to adequately assess.
Mm.
And, I certainly tell to my patients to start doing a work simulation, a graduated work simulation. The cognitive issues are really a challenge, and the distress issues are always a challenge, and I think, again, ideally access to something like a work and neuro-focused occupational therapist could be helpful. And I think to some degree, if they have that and people see that they're functioning well, it provides the reassurance that allows them to feel more comfortable about stepping back into work.
I think that's a really great point, just even thinking about what can you do to prepare yourself, that simulation. I don't know if that's something I've heard before in all of these different conversations. So it doesn't feel maybe such a stark one kind of setting to another when that return to work kicks in. We are actually coming to the end of our session today, so I might just end with both Maureen and Christine. Please feel free to answer this. And what does the future look like in terms of what are your hopes, and where is the research going in terms of supporting such an important time through someone's life, and then and what the employers can do to support it?
So I say from a very sort of immediate end is certainly our hope is that we can keep cancer and workers alive funding wise, and also expand it, to update it and things like that. And I guess, Christine, we can speak to the researches. There's still a real lack of evidence-based practice in return to work. And it would be great we know this model that's built on practice and supported by research. We'd like to sort of get funding to look at it, and also to expand services. I'm the only voc rehab counselor that exists in a cancer hospital in Canada. And that's why this 10-step VR models happen, because of the lack of supports within the system. So we'd like to sort of see if we could expand research and that research guide expanded services. Christine, do you want to add anything?
I think my hope and wish is that eventually everyone who's been touched by cancer can have access to such a service where they can know where to go and obtain the support that they would like. For some, it's okay in terms of preparing for return to work and sustaining work, because even with my other studies, like with fear of cancer recurrence, and so individuals when are finishing treatment, often that's when the dust settles and all the activities and the movement is finished. They're by themselves, and now they're seeing, what am I going to do? Like, oh God, I have to start thinking about going back to work. I don't think I can. Where do I start? There's no direction, and there's no in our cancer care plan, if you want, survivorship plan, there's no indicator. There's not one that says, check off to see if the individual has been provided with support to prepare for return to work, or the impact on their work, or can they go back to work, and what needs to be prescribed in order to prepare them to go back to work. So none of them is happening. It's like it's not part of the cancer care outcome. And hopefully I'm wishing that eventually, in order to say that you are providing evidence-based and quality care to individuals that are touched by cancer, that you can have this indicator of work, the quality, the impact on their work, and if you've been successful to provide the valuable and efficient support.
Thank you so much for those answers, and I think we'll all be watching and waiting and hoping with you for those advances and continued resources into the research and education in this area. So thank you once again to both of you
Thank
for
you.
being here. Thank you to our audience for being here as well, and joining in this presentation. So once again, thank you all for joining us today, and we wish you a wonderful holiday season and a happy new year, and look forward to connecting with everyone again in the new year. All the best.
Thank you. And thank you for
Thank
all
you,
the
everybody.
and thank you for all the
Thank you, Work Wellness.
Continue to learn and connect with the Work Wellness Institute and see how we're transforming research into workplace performance and health at www.workwellnessinstitute.org.